Hi everyone, you're watching All Info World and today we are diving into the world of anesthesia. Let's make it simple and unforgettable. Our topic is ketamine. First of all, what is ketamine? Ketamine is a medication used for anesthesia, pain relief and sedation and also used for treating depression and other mental health conditions. Now we will discuss about mechanism of action of ketamine. First, NMDA receptor blocker. What's mean NMDA? NMDA means N-methyl deaspartate receptors. What is the function of NMDA receptor? NMDA receptors are brain receptors crucial for learning, memory, and signal transmission between neurons. Ketamine blocks NMDA receptors in the brain, and these are involved in pain signals and memory. Next one is HCN channel blocker. Ketamine also blocks HCN channels which affect brain activity and nerve signals. What's mean HCN? HCN means hyperpolarization activated cationic channels. HCN channels open when cells become more negatively charged, allowing positively ions to flow in and helping regulate brain and heart rhythms. Next one is dissociative anesthesia. Dissociative anesthesia detaches the brain from sensory inputs, causing a feeling of disconnection from the body or environment, often induced by ketamine. Now we will discuss about uses of ketamine. Ketamine is used for severe treatment-resistant depression, like as especially with suicidal thoughts. We can overcome these thoughts by using ketamine, and small doses are used to supplement general anesthesia and to reduce the need for opioids. And ketamine also manages pain during and after surgery, and by the WHO, ketamine is a key necessary agent and used in emergency surgeries, patients with low blood pressure and traumatic conditions. We can use ketamine. Next one is structure activity relationships of ketamine. Ketamine has a similar structure to a drug called phencyclidine. We can call it PCP, which was veterinary anesthetic and is known for causing hallucinations. Ketamine is similar to phencyclidine, but ketamine is 10 times less strong than phencyclidine, but still causes some similar psychotomimetic effects. And as we know that mainly used for intravenous induction of anesthesia. And ketamine is useful in children, uncooperative adults for intramuscular general anesthesia. Now we will talk about combination of ketamine. Ketamine can be combined with agents like propofol, midazolam for sedation during procedures of endoscopy and nerve blocks. We can use ketamine with propofol and midazolam. Ketamine can cause hallucinations, but less likely if we will give midazolam with ketamine. S isomer of ketamine. S isomer, and another side we have racemic ketamine. So now we will discuss about S isomer ketamine. S isomer provides stronger anesthesia and fewer side effects and have great NMDA receptor affinity. The single S stereoisomer preparation is not available in the United States but used elsewhere throughout the world. Now we will discuss pharmacokinetics of ketamine. First of all, absorption. Ketamine can be given by multiple routes like as oral, nasal, rectal, subcutaneous, epidural. But in routine clinical use, it is mostly given intravenously or intramuscularly. Next is distribution of ketamine. Ketamine is highly lipid soluble and it increases cerebral blood flow and cardiac output. Redistribution occurs from brain to body within 10 to 15 minutes. Next one is biotransformation. Ketamine is metabolized mainly in the liver. Ketamine is biotransformation in liver to several metabolites like as norketamine. Norketamine retain anesthetic activity. And repeated doses can develop tolerance in the patient. It has a high hepatic extraction ratio 0.9. Short elimination half-life is 2 hours of ketamine. And the next one is excretion. So ketamine is excreted renally. Now we will discuss about ketamine's effects on organs. First of all, cardiovascular effects. Ketamine is contrast to other anesthetic agents. It increases heart rate, blood pressure and cardiac output, particularly after rapid bolus injections. This happens due to sympathetic stimulation and norepinephrine reuptake inhibition. And ketamine is carefully used in patients with coronary artery disease, any other heart disease, aneurysm, or uncontrolled hypertension. Large doses can depress heart function directly by blocking calcium channels, but it's usually hidden by sympathetic effects. These are the effects on cardiovascular system of ketamine. Respiratory effects. Ventilation is minimally affected by usual doses. Now we will talk about racemic ketamine and S-ketamine. Racemic ketamine is strong bronchodilator and useful in asthmatic patients, but S-ketamine has less bronchodilation than racemic form. Full stomach patients are at increased risk of aspiration, and the patient should be intubated during ketamine general anesthesia to avoid aspiration and other consequences. Increased salivation from ketamine, we can overcome this effect of ketamine by using glycopyrrolate as pre-medication. It's an anticholinergic agent. Next is cerebral effects. Old beliefs and new studies. We will talk about both. First of all, old beliefs. Ketamine increases CBF and oxygen use and ICP. Oxygen use means it increases cerebral oxygen consumption and increased intracranial pressure. These are old studies, but new studies provide us evidence that these are not always true, especially when combined with benzodiazepine or used without nitrous oxide. Ketamine is not associated with increased intracranial pressure. Ketamine can cause myoclonic activity, but usually no major changes in EEG. What's mean myoclonic activity? Myoclonic activity refers to sudden brief muscle jerks or twitches, often involuntary. And ketamine is less emergence delirium in children. Ketamine comes closest to being complete anesthetic as it induces analgesia, amnesia, and unconsciousness. So we can say that it's a complete anesthetic drug which provide analgesia, amnesia, and unconsciousness which we need in anesthesia. Next is drug interactions. There are two effects: additive effect and synergistic effect. First of all, additive effect. What is additive effect? Like as with propofol, benzodiazepine, GABA receptor mediated agents, additive effect provides combined effect is sum of both. Next is synergistic effect, in which we will combine ketamine with volatile anesthetics and provide stronger than additive effect. So synergistic effect is most stronger effect than additive effect. So we can call that ketamine provides stronger effect with volatile anesthetics as compared to propofol, benzodiazepine, GABA receptors mediated agents. Neuromuscular blockers with ketamine. In animal experiments, non-depolarizing neuromuscular blockers are minimally potentiated by ketamine. Ketamine with diazepam and midazolam. Ketamine combines with diazepam and midazolam reduce ketamine's cardiostimulatory effects, and diazepam increases ketamine's half-life, means slow elimination. Next one is alpha and beta blockers. These are sympathetic blockers. They unmask ketamine's direct myocardial depressant effect, normally hidden by sympathetic stimulation. Next one is ketamine combined with propofol. Ketamine plus propofol combination 1:10, popular for sedation in regional anesthesia or intravenous general anesthesia in office-based procedures. So it's confirmed that we can use ketamine and the propofol combination in office-based procedures as general anesthesia. Now we have summarized effects of ketamine on organ system. Heart rate increases by ketamine, mean arterial pressure increases by ketamine, ventilatory drive decreased by ketamine, bronchodilation increased by ketamine, cerebral blood flow increased by ketamine, cerebral oxygen consumption increased by ketamine, and increased ICP. And next one is ketamine dose. So this is all about ketamine, and if you are new on my channel, kindly subscribe All Info Word and follow LinkedIn account. Thank you so much, and wait for next video.